Thanks for all coming. I'm very excited to be part of this great venue. And I want to say first a few things about myself. I'm a professor at the University of Chicago. I'm actually a retinal surgeon first, but also I'm a scientist. So I founded the retinal microbiome team and the big data team, basically fancy words saying that we use very sophisticated data and also go to use the bench to kind of find new ways to understand blindness and fight it. So first of all, let's start about why is AMD important. As someone who does it in the clinic every day, I must say that the vision is something we take for granted, all of us, as we move for fast life. We always worry we'll get cancer or die, and we take the fact that we're seeing for granted, but it's not. Many things can take it away from us, and it's something I have people in my chair in the clinic every week, people being devastated. And age-related macular degeneration, or AMD of short, is one of these things. And actually, it's the leading cause of blindness in anybody over the age of 50 in the US. So first of all, what is AMD? Most people don't even know, they don't think about this. So AMD is basically the aging disease of the back of the eye, the retina, in the central part called the macula, which is basically the prime real estate that we use to really look at details and look at the colors and the supervision. And I call it, describe to my patients, like the Alzheimer of the retina. And it's interesting because it really affects your life in many different ways. And I want to do a little test with you. I want you to take 2 fingers and do this. I want you to take this and do this in front of me, okay? So this is how the patients with AMD live. Imagine living the rest of your life without being able to read, drive, work, look at your phone, see the face of the people you love, or do anything for fun, or even see what medications you're taking. Okay, so this is real, and I see it unfortunately every week in the clinic. And not only AMD is devastated, it's also very, very common. So it's as common as all the cancers combined, and it's common as double as Alzheimer's disease. 1 out of 7 of us will get AMD as we get older. If you're over 70, 1 of 3 of you will go blind for AMD. So now you're sitting here, and actually this whole story started, I have a patient crying in my chair, saying, I've lost both of my parents going blind. I've seen this. I took care of them. It was horrible. I'm getting and I have it. What can you do for me? And I would sit there and say, nothing. Fingers crossed you don't get it after 18 years of school. So it really bothers me that I have no better answer. There's no prevention. There's no treatment for 90% of the patients. The only option is for only 10% already go to the advanced stages, already going blind. And the treatment is what I do in the clinic 100 times every week. Shots to your eye while you're awake, sitting in my chair, and I stick a needle in your eye. 4 months for the rest of your life, most commonly both eyes. And these treatments are actually very costly. They're a huge burden for both the patients and the family because they have to bring them and then they have to take them home. It costs billions of dollars. It has a lot of side effects. The treatment can make you go blind faster than the disease. And in the end of the day, most of the patients still lose the vision. So it's very obvious. We're talking about 15 million patients in the US as we talk, 300 million patients by 2040. It doesn't go anywhere. All my colleagues are doing a great job. Everybody lives longer, and then they get AMD and they cannot see, and there's nothing we can do to stop it. So we need to find something better, which is not a shot in the eye, to stop it. So how did this story start? Actually, I have a fun fact how this story started. I remember it like yesterday. I was looking patients in my clinic, and I had this like 90-year-old diabetic ladies, patients, but mostly ladies because it affects more common women, that their retinas look like they're 20-year-old. And I'm like, they should be blind with AMD by now. They have all the risk factors, and their retina looks like a 20-year-old. And actually, my fellow, Lily Goldlas at the time, and all they're taking is Metformin. And I remember telling Lily, I think it may be the Metformin they're taking. Like, their retinas look so good. Turns out when I started reading about it, there's a whole world out there. Metformin is the anti-aging pill. People in Silicon Valley take it because actually people that take Metformin get less heart attacks, they get less strokes, less dementia, less cancer, and it prevents a lot of aging diseases. But what about the aging disease of the retina? What about AMD? Could this actually pill stop the blinding from the aging of the eye? So the million-dollar question we asked, and thanks to the IT and pilot grant that gave us the money to do it, is like, do the people that take Metformin actually have less risk for AMD? And to answer this question, we look at this like what we call big data. So basically, it's like huge data sets that contain millions of patient information. You can see what happens when you take metformin, what disease you take, what medicines you take, all the information is there. And guess what? We asked the question many different ways. And we found that metformin indeed decreased the risk of any AMD, dry AMD, which is in 90% of the patients, and the advanced forms of AMD, both in patients with diabetes and with patients without diabetes, because actually metformin can be given even with people without diabetes. Polycystic ovaries, prediabetes, it does not drop the blood sugar, so actually it's safe to take it, and it reflects most of our patients with AMD. So my big question then is how. For people that know me, I'm a very curious person. Actually, my nickname when I was in ballet by my ballet dancer was like Mrs. Lawyer, because I asked a lot of questions. I did not become a lawyer, I became a doctor, I married a lawyer. But so I was like, how does the diabetes pill affect how the eyes don't get AMD? I start digging, and it turns out that when you read the literature, metformin actually promotes healthy hygiene by promoting health gut microbiome. So gut microbiome, which is like the trillions of microbes that live in their gut, turns out actually is very important for our health. Fun fact, I was born in a small town in Greece, and my mom was a preliminary school teacher, not a scientist. She always told me we are what we eat. And it turns out she was right, after all, like in most things she ever told me, because the diet, it really affects our gut microbiome, and this is how our environment and lifestyle actually communicates with our health. And it's crucial for our health, and actually is a biomarker of aging. So now you tell me, Dimitra, I lost you. Diabetes, metformin, gut, AMD, eyes, how does all connect together? Well, guess what? It turns out that gut microbiome is of the new emerging players in AMD, and actually my lab have shown that is a very causative relation between the gut, what's going on in the gut, and how the AMD manifests in the eyes. So when you look at the different, how metformin works, how AMD happens, how's the connection between the gut and the eye, there's a lot of overlap. And it was like too much of an overlap to be just a coincidence. So could actually metformin stop AMD by actually promoting a healthy and happy gut? And in order to answer these questions, I have to go back to the bench, go to my mice that I give them AMD. Here I'm very happy starting the experiments with the money that ITM gave us to really provide the first proof of concept. And guess what? It was fascinating what we found. I did not even expect to be so blown away by the results. Just 2 weeks of metformin stopped the AMD in the mice and gave them very much healthier and more balanced gut. Not only that, the gut was not only changed, but actually was necessary for metformin to have effect. When I gave metformin to mice that have normal gut microbiome, there was no effect at all. And not only is necessary, the gut microbiome is essential for metformin to work. Without giving the drug to the mice, just giving poop from mice that were on metformin, and then inducing the AMD, the therapeutic effect came back. So just giving the effect of the microbiome to the mice, it was the same as if they take the drug. So metformin, actually, it's a very promising drug. It's cheap, it's available, it's safe, it's been around for 50 years. So I really think there is a really a hope to really transform it and repurpose it to prevent blindness. And we're in the process to try to get funding to get a clinical trial. So stay tuned, and thanks for your attention.